Hey guys, Dr. Joe here with Spaulding Chiropractic. Today I want to talk to you about sciatica. Have you ever dealt with pain along the back of your leg? Ever been told you have sciatica? Or maybe you know somebody that has. Pain in any part of the body is challenging to deal with, especially if it's going down your leg. It can make it difficult to get around, get through the workday, or impact time with your family. So what can be done if we have sciatica? Well, the purpose of this video is to let you know that we can help. But before we talk about what can be done, let's talk about what sciatica is. The sciatic nerve originates in the low back and travels into the pelvic and gluteal region, extending into the leg. Sciatica is a condition where the sciatic nerve is irritated or compressed, resulting in pain into the gluteal region, and sometimes radiating into the back of your thigh and lower leg as far down as your foot. Sciatica can be caused by a spinal or a non-spinal condition. When we talk about spinal conditions, we are referring to things like disc herniations, lumbar stenosis, maybe even a spondylolisthesis where we have a little bit of slippage on one vertebrae to the other for various different reasons. And although rare, there is that possibility of something more serious. The most common cause of sciatica coming from the spine is a disc herniation. That disc herniation causes an impingement along the nerve roots as they exit the spine. That can occur anywhere in our spine, but usually when we're dealing with sciatica, it most commonly occurs at L4, L5, even S1, which is the very bottom portion of our back. Non-spinal causes of sciatica may be related to some form of trauma, maybe some type of post-operative complication, maybe even some gynecological issues in women. Most commonly what we see as in terms of a non-spinal condition is a form of entrapment syndrome involving the deep gluteal muscles. This is referred to as a deep gluteal syndrome and can be attributed to the piriformis muscle or other muscles in the gluteal and hip region. To determine the appropriate treatment, it is necessary for us to delineate between a spinal and non-spinal causative factor. That is why the evaluation process is so important. In our office, we take a thorough history, we perform a detailed physical exam, and this helps us to determine the source of our pain. In most cases, imaging is not recommended. However, if certain indicators are present during the exam, then yes, X-ray, MRI, maybe even an EMG are tests that can be used to provide additional information. We want you to know that we understand the challenge people have when dealing with pain and injury. Our goal is to provide effective treatment that allows you to perform well in work, life, and sport. If you or someone you know is dealing with sciatica, I ask please contact our office at Spaulding Chiropractic. We look forward to becoming part of your healthcare team. So stay tuned for following videos. We're going to talk about how we evaluate and how we treat sciatica. We're also going to talk about different exercises that we can use to alleviate the symptoms and even minimize issues in the future. I want to thank you for taking this time for watching this video. And as always, keep moving.